Hello and welcome to the August edition of the Digital Health Virtual Series. My name is Matt Rayner. I am the publisher here at Healthcare Innovation, and I want to thank everyone for being a part of this program, whether you are consuming this content live with us here today on August the 25th, or you're choosing to consume this content on demand. Thank you for your participation. Today is all about the future of healthcare. Specifically, this August program is going to tackle the new landscape of care delivery and payment. Today's sessions are designed to be interactive. So if you have questions of our faculty today, please do not hesitate to submit your questions via the chat box in the Zoom platform. They are ready and waiting to tackle your questions today, I can promise you. Today's program would not be possible without three wonderful partners of ours: Change Healthcare, Wellframe, and Spectrum Enterprise. So a big thank you to each of you for your support and for making this program possible. Okay, our opening session is a discussion on strategizing forward around optimizing the patient experience. To moderate this discussion, I would like to introduce and welcome onto the virtual stage our editor-in-chief here at Healthcare Innovation, Mark Hagelin. Mark, take it away.
Thank you so much, Matt. Thank you to everyone in our audience, both present and future. I love speaking to people in the future. We're going to talk about the patient experience this morning, and we're going to have a special presentation. So what I'd like to do is I'd like each of our two panelists to introduce herself very briefly and her organization, and then we're going to have Gina do a short presentation. So I'm privileged to have Gina Altieri of Nemours Children's Health and Laura Anderson of Change Healthcare. So good morning, ladies. Welcome. Great to have you.
Good morning.
Thank you.
Good morning. It's great to be here.
Thank you. So I'm going to give each of you just about a minute-ish to introduce yourself, and then Gina is going to give a presentation and things will flow from that. So Gina, would you like to introduce yourself? And then Laura, if you'd like to introduce yourself.
Sure. So good morning, everyone. I'm Gina Altieri. I am the Executive Vice President and Enterprise Chief Communications Officer for Nemours Children's Health. And I am responsible for marketing and communications, internal and external, as well as the Center for Health Delivery Innovation, which I am going to explain, what that is in my presentation. I've been with Nemours for over 25 years, so I have been in a lot of positions, both in operations and the corporate back end. So I have some interesting experiences from a variety of perspectives.
Wonderful. Thank you so much, Gina. And welcome, Laura.
Good morning, everybody, and thanks for having me, Mark, and very nice to meet you, Gina. I'm Laura Anderson. I'm the Chief Product Officer for Revenue Cycle Management Technology at Change Healthcare. I've been with Change a little bit over a year and a half, and I'm not going to say in terms of years or decades, but I've been in healthcare IT my whole non-bartending grad school career and life. I started off at Shared Medical in my early 20s, so worked on the acute care side of the house, have led product management for an ambulatory EMR, have worked in the payer world, and I'm thrilled to be here to talk about one of my passions, and that's improving the patient journey.
Wonderful. Thank you both. So Gina has a small presentation to share with us, and it's all about how the leaders at Nemours Children's Health created their strategy around digital health and the patient and family experience. So Gina, please take it away for us.
Sure. So I believe that Cassie is going to share my slides.
There we go.
And here we go. So I wanted to give a little overview of the evolution of Nemours, and I wanted to explain how what we did in order to create a digital experience like the in-person experience that Nemours is so well known for. You know, we really do hang our hat on treating patients differently than perhaps others may experience at other places. So we started back in the 70s. And at that time, we were just an orthopedics hospital, and we were only in Wilmington as the Alfred I. DuPont Institute. And the child is and was at the center of everything that we do. We've evolved since then to go beyond the walls of just the hospital and move into other geographies and other forms of care. So we now have clinics and pediatrician offices and ambulatory surgery centers, and of course that virtual experience. And we've just completed a brand new 5-year strategic plan, and that strategic plan is taking us even further and even beyond medicine in ways that we really never even considered. So we are trying to develop strategic roadmaps that help us impact not just one child, not just the family of a child, but communities everywhere. So we're going to where children live and learn and play helps them create a healthier lifestyle, which we hope actually creates generations of healthy children. Next slide. So the digital health's role in advancing value. One of our strategic pillars is health value and equity. And so we are trying to figure out how a pay for health model will impact not just our bottom line, but care. And so we're doing that through digital tools. We conducted a telehealth survey to find out more from families about those social things that impact children's health. Like I said, we are going beyond medicine to address those non-medical factors that impact children's health. And then we are also leveraging this predictive analytics technology. I think Laura will appreciate this. So we've had an electronic medical record now for over 20 years, and we also have our Kids Health website for over 25 years. And so we are now able to leverage a lot of the data that has been built into those systems, if you will. Next slide. I mentioned Kids Health, and I did want to explain exactly what that is. So Kids Health is more than just a consumer website, right? We also have products that we develop under the brand Kids Health, and they are how-to videos, patient instructions, primarily like discharge instructions, multi-languages. We have condition-specific content that is integrated into patient care plans. And all of this is accessible in a variety of formats. Next slide. So another avenue of digital work is our telehealth program. And I'm sure many have experienced this, but building the solid infrastructure to make it seamless takes quite a long time. And like I said, we have been working on that from the day we decided to have an EMR. And so when we went into telehealth, we decided that it would be one platform for the entire organization. It would be completely integrated into our Epic electronic health record. All of the encounters are specific to the specialty. We have billing infrastructure already built into this, as well as documentation guidelines, and that all of that Kids Health content that I mentioned is also a part of the telehealth experience, so that when a family is given instructions on what to do after the visit, they access the Kids Health patient instructions following that visit. Next slide. So we did have this challenge in that we did have all these wonderful electronic tools, but they were all very separate and distinct, right? So we had our patient portal, we had the Kids Health website, we had our internal nemours.org, we had our Care Connect, which was our separate telehealth application. And then we also had a reading assessment tool called Reading Bright Start. And for patients and families, they didn't know that all of those things were actually Nemours, that they were experiencing Nemours when they were experiencing these tools. And it was not that convenient in that they had to go into these different applications or forums to get what they were looking for specific to the role of those items. And so to solve that challenge, next slide, we developed this Nemours Act so that all of those different digital experiences were now packaged in one digital experience so that the patient and family only had to go one place to get access to information, to get education, to find the expert that they were looking for, to schedule that appointment, to also find what locations we were actually at and help them get to a location if that is the way they chose to receive care. Or if they wanted care right then and there, we had them access the telehealth through the app. Next slide. And so this is an example of, you know, what the app looks like. It is mobile ready, so you can, you know, experience all your care through your phone or your iPad. Like I said, all of these functionalities that were individually in the different areas are now in this one app that patients and families have and can access throughout, you know, the care that they need. Next slide. So one thing that I wanted to share is what happened during COVID. All of that work that I just described has been going on pretty intensely for the past 5 years or so. So we had all these disparate parts and we put it all together and had this wonderful thing, and we were testing out, you know, if this could work by using an asthma proof of concept, and then we developed it into other things. And then COVID came, and it actually made it very real. So what we were doing was something that all of a sudden was in demand from the patients and families. And so I want to share some of that with you. Next slide. So during that time, we did have 3 goals from, you know, a communication perspective, both internally and externally, and more importantly, that patient experience, right? So we wanted to take into consideration safety. So overall, our communication efforts needed to keep patients and our associates safe. So, you know, one aspect of being safe is being informed. So that was important. And then volume. You know, we saw cancellations overnight. And so how would we be able to provide the care that was necessary? Because in some ways, pediatrics is different, you know, than adult care in that elective isn't quite the same as it is in the adult world. So volume was important. And then education. How do we keep our internal associates as well as patients and families informed and educated from experts, people that they could trust, talking about this new pandemic that, you know, we were learning on the fly about. And so they were our 3 goals. So moving forward, next slide. We used Kids Health because we knew that we had, you know, 1 million eyes on this site every single day. And so how could we get the word out It is a very well-respected brand, and so patients and families, and even those that have never experienced Nemours or come to our hospitals for care, have been using Kids Health for some time. And so we did publish our first article on the coronavirus in January, before, you know, it really became mainstream in March and everything shut down. And so that was a very early move to inform consumers of all kinds. And we continue, as you can see on the right there, continue to have articles on an ongoing basis about what this means. And then more importantly, what does it mean to your child? Next slide. This Center for Health Delivery Innovation that I mentioned, it includes a lot of different functional areas. So it includes this consumer insights group that looks at the data. It includes design thinking, so that again, we really do understand that patient journey, Laura, and that patient experience from perhaps a different way of thinking. It includes a telehealth team, this patient education team. It also includes a group of developers. So there's a lot of technical people in the Center for Health Delivery Innovation. And their goal, as far as what they were trying to achieve for patients and families from an experience, is to hopefully make healthcare simpler. So how can we get them to understand the information they're being told? How can we help them get access to what they need in the simplest, fastest way possible? Next slide. We used a variety of forums to communicate to patients and families about our changes in policy, about closures, about the importance of getting care. And these are some examples of how we used our social media to communicate with families and how we used other forums. It was very effective. Next slide. Another very important aspect was every single Wednesday we did have a huddle so that the marketing team and the communications team and the technical team and the Center for Health Delivery came together to understand exactly how we all needed to work together to have a consistent message and a very timely message, both internally and externally, which did serve us very well. And then we also had a COVID task force system-wide that I sat on and brought back information to the marketing and communications team so that I was aware of some operational issues that perhaps were impacting us in different ways. And this is an example of how we adapted the primary care model. And the communications team needed to know this because they needed to inform the families. And of course, the telehealth team needed to know it because they were partnering with operations to make this all happen. So what we did is we created in-person well-child visits by putting up tents, if you will, and having people drive through. We then integrated telehealth into this for those that needed to see a specialist at the time or couldn't even get, you know, to the tents. We called those telewell visits. And then we also had a variety of specialties that could access these 36 physical locations. We had almost 800 physicians providing telehealth visits because no one really could leave at a certain point. And most of those physicians, thankfully, had already been trained on how to deliver a telehealth visit, and they had all the equipment necessary to do it. And then we had these testing locations, SCAT locations, where patients and families could actually come through and verify whether or not there was a COVID situation. And we also added 8 immunization drive-through clinics because, as you know, children receive immunizations at certain times in their growth and development. And we really did not want that to stop or be delayed. And so we were actually able to show that our immunization rates improved during COVID rather than, went down. Next slide. And this is another example of how we had telehealth visit right there with the family pulling up. We were able to register them, pull up the patient's chart, do the exam, and here's some of the stats that I was referencing about the improvement of the vaccination rates. Next slide. In addition to primary care, we also deployed this for specialty care. And like I said, we were fortunate that we had all the infrastructure. However, what we did not realize was the extent that the families weren't really ready for the telehealth visit. So perhaps their technology wasn't quite what it needed to be, or their connection wasn't what it needed to be. So we really did have cross-functional teams. People gave up their regular full-time jobs to do this. And we had teams of people getting families ready and in queue so that they could be seen by the doctor, more efficiently. And so again, it helped us understand what was really needed to improve the experience of a virtual visit. Next slide. These are some of the stats. As you can imagine, we increased our telehealth over 1,000% during that second quarter, when everything shut down in March. And it is gradually coming down, but it isn't anywhere near the level it was before COVID. So in some ways, we're fortunate in that, you've heard this line, the genie's out of the bottle. And it's not really going back in. People are starting to really understand that this is another way to experience healthcare, not necessarily a complete replacement, but it's definitely an enhancement to the experience, both from the provider and the patient and families. Next slide. And in closing, I just want to reiterate that Nemours, this is our new brand, our new logo, which is in a sense bringing our new strategy to life. Well beyond medicine is our new tagline. So you'll be hearing and seeing more about Nemours and the new kind of patient experience that we're looking to implement here. So thank you, everyone.
Thank you so much, Gina. I'm just going to ask you one question now, because after we speak with Laura for a few minutes, and we're all going to stay together and talk. But what do you think the biggest couple of lessons learned have been for you and your colleagues around pursuing this really comprehensive approach? You guys did everything, right? I mean, I'm very admiring of that. What were the couple biggest lessons you learned in doing this, in recreating and reimagining the patient and family experience?
Yeah, I think that I would say stuck to our core value, that the service level and the experience that we are committed to matters, whether it's in person or virtual. And that we needed to leverage what we already knew people expected from Nemours. So they expected kids' health, right? They expected that information. They expected to be able to go online and get information. When they actually come and experience Nemours in person, they expect that level of service every time, right? And so we wanted to incorporate that in any experience. That was very important to us, and that had to become a part of our strategy so that everybody understood the alignment necessary to create that kind of experience.
That's very important. Thank you so much, Gina. We'll come back to you in just a few minutes.
Sure.
So Laura, tell us a little bit about, let's start at 40,000 feet up, your perspective on what the patient experience means. And it's very interesting, of course, because you're handling revenue cycle management. And one element, of course, is the patient and family facing element for providers. How do you see all this right now?
Yeah, thanks, Mark. And first of all, Gina, that was a great presentation. I really enjoyed it. So thanks for sharing that with us. You know, I've been talking about this for a while, and when it came to Change Healthcare, we think of revenue cycle management as, you know, the bill. You know, what do we have to do to get the bill out of the door? And I think beyond COVID, if you look at the trends in the market and the rise of the consumer, and that us as patients and consumers are the third largest payer from a self-pay perspective, and you look at the rising costs of healthcare, patient experience and helping patients navigate through a highly complex healthcare IT environment has become paramount. So when I think about revenue cycle management, I really don't think about just the back office and the bill. Instead of, you know, how traditional revenue cycle management is often defined in the market as front, middle, and back. You know, front being the patient shows up, middle being they're there, we're going to code, back being we take the codes and the bill drops. I think of it as pre-visit, visit, and post-visit. And so when we approach the patient journey and the patient experience from a revenue cycle management perspective, it's less about the bill and why that's important and why our job is to help our customers, you know, reduce cost to collect and ensure that they're getting paid on a timely basis. If you take good care of people, then getting paid on time and getting paid quicker is a natural byproduct. And so for me, I always personalize this. I shared with you guys before this started, my daughter was treated at Nemours. And as a matter of fact, they saved her arm. Her elbow was shattered because of a horseback riding incident. I have 2 aging parents. My dad is struggling with 3 chronic diseases. I'm a single parent, and I have a child with epilepsy, and I have a child with anxiety. And so I always think about my kids, my parents, my friends, and one of my best friends who's a chief medical officer at one of the hospitals here outside of Philadelphia. And I think about what can we do to make it easier for my daughter, my parents, me, you, Mark, you, Gina. And it's about creating, and we all know healthcare IT is a little bit behind other industries. But what's really great, in some ways, COVID has helped fast track that retail-like experience with healthcare. So, you know, similar to shopping on Amazon, or, you know, easy to schedule, easy to get information, easy to pay. So I know that was a long-winded answer for a 40,000-foot view level, but at the end of the day, our approach is thinking of consumers as they're human beings, they're us, they're patients, and putting the patient in the center of everything we do. And that has really changed our thinking about how we approach creating technology to help enhance and improve that patient journey.
Great answer. Thank you, Laura. I appreciate that viewpoint. Gina and Laura, what do you think the biggest challenges are to really creating a great patient experience across the experience of healthcare?
Gina?
So I do think I have a few. One is that infrastructure, right? It's difficult to just take something off of the shelf and have it be embedded in your workflows. So having the infrastructure. The other thing that we found is the buy-in from not just those consumers, but from our providers. Mm-hmm. So yes, I'm with you, Laura. We were all about, you know, looking at the patient and family as a consumer and trying to emulate the retail experience, and getting then the providers to understand this is what the consumer is telling us they want. So how can we make this a win-win so that it's simple for the consumer, they get what they need, convenience, and the provider gets what they need. And the providers worked with us to develop this. And so what they needed was data, and primarily the information that was not readily available to them between visits. So what's going on in this patient's life that either the parent forgets because it's been 3 months since they saw me last, or they didn't even realize this thing had an impact on this child's health. But when they had the data in, at their fingertips during the visit, they could see things and diagnose things and understand things differently. So that was an important feature as well.
Laura, what do you think about that element of that patients, families, consumers, whatever you want to call us, we need data and information? That's a part of the experience. And I'm sure that touches on the areas you cover also.
100%. I mean, data is, it's sort of the nucleus of the cell, but it's not really about the data. It's about the insights and what you can do with the data. And of course, to Gina's really valid point, it's getting access to that data. And so in terms of the challenges, it's access to the data. What do you do with that data? And frankly, if you think about what care providers do every day, whether it's a physician, nurse, PA, care coordinator or whatever, they're almost like they have that artificial intelligence, for lack of a better term, in their head through those protocols. So from a provider perspective, it's how do you take that data and the clinical protocols and put it in a consumable fashion that's going to be easy for them to use, enhance their workflow, not break their workflow. And from a consumer perspective, it's prompts to get them to, remember, to Gina's point, oh, well, this is, the history, the family history, or, oh, I forgot, so-and-so had this challenge, and we need to document that. But then taking that and then applying intelligence so that that information doesn't need to be repeated over and over and over again.
Yeah, absolutely. And what do you think the organizations that are doing the right things are doing right now in that regard? And then I'll have Gina, who's in one of those organizations, answer that.
Well, I think, to the presentation earlier, it starts with the commitment that the organizations that I work with, or that my company works with, that is doing this well, one, they're making a commitment to, yes, it's about putting the consumer in the middle, the patient in the middle. Yes, it's about acknowledging this is not easy. And working with the providers. I loved your reference to design thinking, big fan of design thinking, and talking to customers, the voice of the customer, understanding what the providers need, understanding what the patients need. So the organizations that are doing it well are also making an investment in that infrastructure. It's not easy to create a holistic experience from pre-visit outreach, virtual lobby, for lack of a better term, completing all that paperwork that we used to do and still do sometimes with the clipboard and the paper, and filling that out online, which the sooner these organizations have been able to take what was manual and on paper and put it online to collect and keep that data, and then apply some analytics to it and some AI to make some predictive assumptions. Let me give you an example. I have a facility that is able to show me all my female patients over the age of 40 who are overdue for their mammograms. They do outreach through a text message to those women. Hey, you're overdue. We also noticed that you're overdue for a well visit. Click this link. Would love to have you schedule it. Please come in.
Yeah,
so
absolutely, I agree. Gina, what are the organizations that are doing it right, doing a top few things?
So I think, as Laura said, the commitment and investment is one thing. So I think that having it tied to your strategy creates that alignment, and it creates the commitment and investment that is necessary to do this. When I first suggested having a team of design thinkers. I think people thought I went off, but it was very important to have that. Jefferson bought a school of design for that very reason. So we had our little tiny team of design thinkers. So I think that's important because it helps people look at this journey from the family's perspective. And again, making it simple so that they'll use it. That's very, very important. And then, as you were alluding to, Laura, making sure all these communications are integrated. So, the CRM, there's an ad, somebody clicks on it, they make an appointment, they come in, next thing you know, they have a service, and hopefully they pay their bill. That whole thing is now captured, and you can actually see, do you have an ROI for those efforts? Or are you communicating to this patient all different ways, all different departments, communicating different information? It appears that you're not, this well-oiled machine. You have billing communicating one way, you have your providers communicating another, you have marketing communicating another. You want to make sure that you're always communicating the way the patient wants to be communicated with, and that it's consistent messaging. So that integration to me is also a critical component.
Very, very good. Laura, I know that you and your colleagues internally are pursuing AI as you move forward in thinking about, and I think there's an interesting connection here, if you'd like to help us make it, between figuring out what's going on and then how you communicate to patients, families, et cetera, consumers. Any thoughts?
Yep, couple. So I'll use Netflix as an example. For those of you that go to Netflix or use Netflix and, you watch your favorite shows, then Netflix starts to make recommendations, or Apple TV, whatever streaming service you use, Hulu, based on what you're watching or what you have watched, it starts to make recommendations for what you could watch. So let's take that Netflix mindset or philosophy, and now let's apply it to healthcare. Hey, Laura, based on the fact that you live 25 or 15 miles away from XYZ, and we've seen that, your interests in health are nutrition, behavioral health, or whatever, your insurance is healthcare insurance, ABC, we would like to recommend this practice, and based on your deductible and copay. So what we're doing is we're taking AI and making some predictions from a patient journey perspective, from a facility perspective. We're also using AI to say, hey, based on these codes, based on this patient experience, this information is missing. Denial propensity scoring, making sure that the information's there, or prompting the end user to ensure that there's a holistic view of what happened to the patient. So one, the patient is receiving better care, but two, again, my customers are the providers, and making sure that the providers, institutions' health and well-being is financially healthy.
And so, Gina, at very good points. Thank you so much, Laura. Gina, I know that at Nemours, you guys do love data too. How has data analytics or leveraging it helped you in your strategy in terms of creating that patient experience?
Yeah, so a few things. One is with research. Right? So now we have a lot of data. What is the data telling us? And can we develop a research study out of that? So we are combining, it brings back that integration point I was making. We're combining some of the researchers with the telehealth team to see if there's an aspect of research that we can work on together about this experience. Another thing, I guess, to take Laura's example a little step further is, from a patient experience perspective, we may say to a family, you know, like you were saying, looks like this visit you're a little behind on, or so-and-so's coming up on that vaccine. We see that you have 3 children. Would it be convenient if we scheduled this follow-up with that primary care? And it seems to be very appreciated, you know, from the family. We'll also say to them, yes, you're looking at Wilmington, but did you know that we actually have an allergist being, you know, seeing patients in your zip code on Tuesdays? Would that be more convenient for you? And it's all done behind the scenes, not a person, you know, trying to figure that out.
Yeah, absolutely. I think making one word that neither of you have used, but that kind of is subtextual to everything we've talked about, is seamlessness, right? Both of your organizations are looking at seamlessness for patients, consumers, families, and also kind of an operational seamlessness, right? Like, in order to make all this work, you have to make it work. You have to make it not a million unconnected or disconnected parts. You referred to that, Gina, you know.
Yeah, Mark, you had asked me, how do we make sure it's tied to our strategy? And, you know, part of our strategy is this strategic rebranding. And I'm trying to make the point to the organization that our brand is not just that logo that I showed. Our brand is every point that the patient and family has with us, whether it's in Delaware, Pennsylvania, or Florida, in the clinic, in a hospital. That's all of our brand, right? And they expect that same level of experience. Yeah. And we're trying to say that however we develop it, it has to be everywhere, all the time, the same. Right.
And I'm sure you have that also, Laura, in working with customer organizations, helping them to realize that the experience of the patient or their family member has to be good all the time. It can't.
Yeah, 100%. And I was thinking, I love the word seamless, but what we're also trying to do, and this is going to be a little cheeky, but is to eliminate the silliness. And so what I mean by that is, you know, how many times do you go to a restaurant and you're given a menu with no prices? That happens to us all the time when we're going through healthcare, meaning, you know, we're experiencing services, but we have no transparency into what it's going to cost. So, of course, you know, price transparency and making that information available to the patient at pre-visit, and then tying it to their healthcare insurance, and then using AI, understanding, Gina made the point of social determinants of health. Do they worry about food? Do they worry about shelter? Are there things that we can do to help them not worry about how they're going to pay for healthcare? Another example is how many times, and I guess I must be hungry because food and restaurants keep popping up into my head, but how many times have you gone out to eat and your server asks you 8 times, are you allergic to peanuts? So that's what I mean when I say reducing the silliness. It's also about integration, a holistic end-to-end experience, making that, to use your word, seamlessness or seamless, but also reduce the silliness and enhance that workflow, not just for the provider, but for the patient as well.
Yeah, absolutely. One of the things that seems obvious to me, but I know that it's difficult to execute on, we all have heard stories, every one of us, you know, your best friend's sister-in-law's neighbor's cousin says,
cousin's brother.
You're right, exactly. Says, well, I just had a really bad experience. I went to an outpatient clinic and some staff secretary was mean to me, right? And you know, if you're inside that organization and you hear the story, you're like, oh my gosh, well, that's just this random occurrence. We have wonderful staff, you know, we have wonderful clinicians, and yet that little bitty experience is the patient experience, right? It doesn't matter that the the clinicians did all the right things in caring for that patient. That one staffer was quote unquote mean to her. I think one of the interesting things about the patient experience is we go more virtual and more technological, especially younger people, will be going forward that every encounter has to be satisfactory, right? And things that might not have been quite as make or break years ago are going to be so. And one of the reasons, and where I'm heading with this, is all the surveys are finding, and all the consumer polls are finding, that younger people, and I'm not sure who I exclude here in the term younger people, but people under 50 have far less loyalty. You know, I'll just tell this story. My grandmother was born in 1888 and lived to be 100 years old. Yeah, 99 and 2/3 years old. So in her day, which really was a long time ago, there was reverence for doctors and healthcare
Yes,
Absolutely.
And keep in mind, when my grandmother was a young person, so we're talking 1900, literally, most people weren't educated in this
Correct.
country. And doctors especially were seen as, you know, like almost demigods. All of that has completely shifted now, right? We're in like a wildly different world. And one of the things that I think will be interesting is everyone will be competing to provide an experience to the healthcare consumer and their family that is superlative, because this loyalty is not going to be there, right? My grandmother, when her doctor said, Mrs. Fenner, take the blue pill, she took the blue pill, right? Like she didn't even question it. Now, your patient is going to say, well, I just looked up this study from the New England Journal of Medicine on my phone, and it says, I don't know about the blue pill, right? So we're in a very different world now. Both of you, thoughts on that, the fact that healthcare consumers, and we're all healthcare consumers, we're not my grandmother, right? Like we're really different people in a different world. And so the patient and consumer experience is going to have to be very different. Thoughts, both of you.
We did a poll not too long ago where we surveyed a lot of customers, patients. 1 in 3 patients said that they would switch providers for a better patient experience.
Yeah.
And so to your amazing point, when we say providers, we're not just thinking about the physicians, we're also thinking about that front office person. And yes, we're transitioning more to a virtual world, but that front office person could end up being a bot in the future. But the point is we can't help that people have bad days, but what we can help is it is not easy for people to ask other people for money. So how can we make their jobs easier and make the patient's experience more pleasant by scripting? How do you talk and how do you code? How do you train those front desk people to feel more comfortable with that conversation, which ultimately and in theory will improve that patient experience? So 100% tracking to what you're saying.
Thank you. And Gina, you know, you mentioned before you consolidated everything into your app, people were experiencing Nemours literally 10 different ways and they didn't know it. So before you did what you did, and you had to have tons of tech people and tons of clinicians and operational and process people, what was interesting was you were losing some potential there in terms of that bonding, right? Because people didn't even realize, oh, this is Nemours.
So, right, absolutely. You're right. It is more challenging now because the millennial uses the internet in different ways than I have, right? And so they have access to information and they challenge the providers with the information. And so that's why at the beginning I said it's important that we are seen as experts and thought leaders, so that when they hear something from Nemours, they do recognize it as a trusted resource, because there is a lot out there and not all of it, is accurate. So that's an important feature. And that's why I want to make sure that consumers understand when they're on this Kids Health website, that is Nemours speaking to them from a variety of children's hospitals. They buy our content and they put it out there as their own. And at some point, we'd like everyone to understand you're really listening to Nemours on this. We've been very quiet and humble about all this great stuff. And so I want people to start understanding that is Nemours. And then the other important thing is the respect, goes both ways. So although perhaps the providers aren't quite on that pedestal, families weren't treated that nicely before either. It was this way or the highway, right? And so now we try to provide the care together. Your child, let's see what's going on. Here's some options. What would work better, for your lifestyle? So that's important. And then the other thing that I think impacts all of this is social media, right? I mean, look what it did in politics. It gives people either a megaphone about what they want to talk about, good or bad. So now that example that you gave, Mark, of the distant friends, relatives saying something, they don't just say it, on the phone. Now they put it out there so hundreds and thousands of people can read.
Yeah, exactly.
Have a very good experience.
Yeah, exactly. And I'll add another thing. I know that Nemours you guys are famous for a wonderful experience for parents of children. In some places, and we won't name them, people are still reporting as parents of young children that they're being patronized, right? I know not at Nemours, but there are places, and I've heard people tell me, I took my 5-year-old in to see the pediatrician, and I was, the pediatrician did everything but say, don't worry your little head, little lady, right? And consumers are just not going to take that anymore, right? It's a new world, and they're going to put things on Yelp, and I don't know, they're going to be platforms that will be really scary in the future, where like every single one of us will be critiqued by someone and it'll be online forever. I'll just share one last story and then I'll ask for closing thoughts. This was actually almost 20 years ago. I was interviewing Paul Tang at Palo Alto Medical Foundation, and they're in Palo Alto. So most of their patients are connected to Stanford in some way. They might not be faculty, they might be faculty family, they might be students, they might be, whatever, but it's a very highly educated market. And I was talking also to a family physician who said, this was 20 years ago. And he said, my patients come into me and to see me with like reams of paper that they printed out from the internet. And I'll say, well, I think blah, blah, blah. And immediately they'll riffle through the papers and go, well, I'm reading this article from the British Lancet, and it's right. And so you're right, Gina, we're going to be in an era where consumers are going to be questioning. So I think a core part of the experience going forward will be, as you said, putting out information that is truly authoritative and positioning your organization on all levels, from the patient care side all the way to the RCM side, as a trusted organization, so that you tamp down some of that pushback and that people actually do trust you, which is really important. So I'll ask each of you, we just have a couple of minutes. I'll have you go first, Laura, and then you, Gina. Advice for our audience around everything we've been talking about just now, just a few things for them to think about and walk away with from this discussion.
Yep, thank you, Mark. Lean in, be open-minded, and be committed, and think outside of the box in terms of it is about a holistic seamless experience. And for those of you who are listening to this either live or recorded from a revenue cycle management perspective, you know, studies show, and you can read it on the internet, the better experience that a consumer has, the more likely they're going to pay their bill on time, which has an upside for your organization. So I highly encourage you that if you do not have a patient experience strategy or patient journey strategy, to please start thinking about one for a myriad of reasons. But at the end of the day, I firmly believe it's the right thing to do for people today. In a world with it's highly complex. We're still dealing with a pandemic, and I think it's the right thing to do.
Perfect. Thank you so much. Gina, closing thoughts.
I agree with everything that Laura said, and I would say another important factor is choice. You know, I had mentioned earlier, I'm in the Philadelphia area, and we have a lot of choice here as far as really good quality care. And so sometimes that differentiator is that patient experience, right? And so don't forget that as very integral to the journey, right? And so I think that that's important to recognize, that you're not captured automatically because somebody said you should go here. Consumers are much more educated now, and they decide, sometimes they do decide on price, and it's very difficult for them to say, well, how do I know, you know, that you have better outcomes and you're worth 4 times what it's going to cost me for, you know, let's say a knee replacement if you're an adult. So yeah, they want that information, and so we have to provide it. And I do think we have to remain curious, right? I think you used a similar word, Laura, when we are listening to the consumer's desires. And if you're listening from a curious perspective, when you explain why it's important they come to Nemours or go to whatever healthcare system, that they really do feel like you gave them the right reasons to go there. You know?
Perfect. Thank you both. Thank you. And I'm just going to go back to my grandmother. I'm kind of feeling inspired because she grew up on a farm in Wisconsin. She was born in 1888. And again, in her world, well, she was rural for the first half of her life. Then she moved to the city. Most people were not educated. Physicians were seen as gods, and people didn't have choice. Like, I'm sure whatever provider she had in the little tiny town nearby her, that was it, right? Like, I mean, she grew up even before cars. So we're moving so far from that world now. And our children and our grandchildren they've got the phone in their hand when they're 18 months old, right? So I think the key point for everyone will be really think about the patient experience as a wraparound to everything that you're doing, because the patient consumer experience will help determine your stickiness with consumers. So Laura and Gina, thank you. This has been so great. We really appreciate it. And Matt Rayner is here to close out. Thank you all so much.
Yes, and I'll just echo that. And thank you, Mark, and thank you, panelists. A great way to kick off the August Digital Health Virtual Program. We are now going to go on a very short break. We will resume here at noon Eastern time for a session on budgeting for tech investments, a conversation on how tech dollars are being invested in 2022. So go stretch those legs, respond to some emails. We will see you back here at noon Eastern time. Thank you so much.